So, Bismillahirrahmanirrahim. So, last time we were discussing about nutritional disorders, nutritional pathology. Just overview of the nutritional factors. Today we will discuss about vitamins. So, there are two types of vitamins. You are already well aware, studied in the previous classes, biochemistry as well as in the physiology, vitamins. So just recall your memories, quick review. So two types of vitamins: fat soluble vitamins and water soluble vitamins. So fat soluble vitamins are vitamin A, vitamin D, E, and K. These are the fat soluble vitamins, while water soluble vitamins are vitamin C and vitamin B complex vitamins. So they are very important. These vitamins are very important for our normal healthy life. So vitamin A, other name is retinol. So it's very important. So what are its main functions, physiological functions of retinol in our body? So this maintains the normal vision in reduced light. So this may involve in the synthesis of rhodopsins, a light-sensitive pigment in the rods and cones of the retina, by oxidation of retinol. So this pigment then transforms the radiant energy into nerve impulses. So this maintains the structure and function of specialized epithelium and maintain the normal cartilaginous and bone growth. So this is the few important physiological functions of the vitamin A retinol. So it's play a vital role in the vision, our vision. So there may be a night blindness occurs due to the deficiency of vitamin A. Sources of vitamin A. So which foods which contain the vitamin A? So there are some sources, animal sources, such as eggs, meat, and dairy products, milk, fish. So these the carrots which are the rich in vitamin A source, leafy vegetables, mostly the carrots. They are the rich sources of vitamin A. So there are some fruits and vegetables as well. But carrot, they are contain rich source of vitamin A. So what will be defects when vitamin A deficiency occurs? What will be the pathological disorders? There very common the night blindness in our society, in our villages. The people who not take proper diet in their routine life. So they may suffer from the night blindness due to the deficient intake of vitamin A. So there may be ocular lesions, cutaneous lesions, skin disorders. So they may be dark spots, hydrophthalmia, eye changes. So these are the most common deficiency disorders of vitamin A deficiency. Yes, this is the myotitis spots. This child suffering from the vitamin A deficiency. So what will be pathological changes? Which due to a vitamin A deficiency, there may be some changes are seen. So ocular lesions in the eyes are most obvious. So there is night blindness, most common due to vitamin deficiency, which is usually the first sign of vitamin deficiency. As a result of replacement metaplasia of mucus secreting cells by squamous cells, there is dry and sclera conjunctiva, exophthalmia. So the lacrimal ducts also shows hyperkeratosis, and corneal ulcers may occur. So white spots may appear, which are focal triangular areas of opacities due to the accumulation of keratinized epithelium. I just showed you the figure. This is the white spots due to a vitamin deficiency. So if this occur in the cornea, there may be transmissions of the light. Ultimately, infection, scarring, and obesities leading to the blindness. So there may be cutaneous lesions. The skin develops papular lesions, giving toad-like appearance. Xeroderma. This condition is xeroderma. This is due to the follicular hyperkeratosis and keratin. So bulging in the sebaceous glands. So there was development of the xeroderma, skin changes due to a vitamin A deficiency. I have already told you the sources of vitamin A I discussed. So the major source retinol are liver, dairy products, eggs, and carotenes found in the various vegetables, fruits, dark green leafy vegetables, bright oranges, rich source of the carrots. So carotenes may also be present in the foods I have told you. So daily recommended dose RDA is 5,000 international units for men and 4,000 international units for women is the daily recommended allowance of vitamin A. So we should take this vitamin A in our daily routine diet. So this the medicine department will teach you in the final year. That you should know. Other is very important vitamin D. This is also fat soluble vitamin. So vitamin D, other name is calciferol. So there are important functions of vitamin D. Almost importance in the regulation of calcium and phosphorus metabolism in the body. So it serves to maintain the proper blood level of calcium and phosphorus by promoting their intestinal absorption and by mobilizing these minerals from the skeletal bones when they need it. This is the very important. The children who are deficient from the vitamin D, there may be suffer from the tetany, fits, seizures, rickets, osteomalacia, we will discuss later on. So there's the mineralization of the skeleton and teeth requires adequate supply of vitamin D. So children's who delay grow off their teeth, there may be low supply of vitamin D, deficiency of vitamin D. The sources of vitamin D. So the body itself makes vitamin D from the exposure to the sun. With the natural, God has gifted the natural source of vitamin D through the suns by the skin. So the sources which contain the vitamin D, the cheese, butter, are grains, fortified milks, fish, and fortified cereals are food sources of vitamin D. So these are the sources of vitamin D. People in the other countries, they take the sun bath, so they may be not suffering from the deficiency of vitamin D. So sun baths are in the sun, outside in the sun, in the cold weather is very important for to make vitamin D. So I have told you sources: fish, liver oil, good source of vitamin D, natural foods. There is egg yolk, liver, and fish, such as strides, salmons. These are types of fish. So recommended daily allowances mostly 400 international units per day is the daily supplement of vitamin D. So exposure to the sunlight even for 5 minutes per day is very important. So you should know it is very important sun exposure for to make vitamin D. So there are some common disorders, pathological disorders due to vitamin D deficiency. Tetany, development of seizures, fits, हाथ मुड़ जाते हैं, झटके लगते हैं बच्चों को, rickets in the children, osteomalacia in the adults. So these are the most common deficiency pathological disorders of vitamin D deficiency. So tetany, this is the characterized by low serum calcium. So you should remember how tetany occurs due to the low level of the serum calcium. So calcium absorption is very important in the presence of vitamin D through the intestine. So you should remember. So these are the interlinked with each other, vitamin D and calcium. So there is low serum calcium. The child suffering from the tetany, so less than 75 milligram per 100 milliliter. So there may be muscle twitching, cramps, and convulsions. I told you fits are convulsions, tetany. The children, especially in the children's, due to low level of the serum calcium in the blood. So it results from the insufficient absorption of the calcium due to the low level of vitamin D, from the disturbance of the parathyroid gland. Parathyroid PTH play a main role in the maintenance and regulation of the calcium in our body. Other conditions which occurs in the adults are osteomalacia, frequently called as adult rickets in the adult persons. बड़ों को जो रखते हैं अमूमन होता है वो ऑस्टियोमलेशिया होता है एडल्ट्स रिकेट्स बड़ों में, बच्चों में जो 15 साल से नीचे हैं रिकेट्स, जो 18-20 साल से ऊपर हैं ऑस्टियोमलेशिया. When there is deficiency or lack of vitamin D and calcium, both. So it may be also occur when there is an interference with the fat absorption and hence vitamin D absorptions. There may be disturbance of vitamin D absorptions. So there may the person may suffer from the osteomalacia. Yes, this osteomalacia joint, hip joint, disease of the hip joint. This patient is suffering from the osteomalacia. Yes, this osteomalacia. So we can say rickets, children rickets. So this child is suffering from the rickets. Rickets, what is the etiology? So there is poor exposure to sunlight. So the children especially may also be related to the inactivity of the malnutrition children's. So disturbed metabolism and poor synthesis of vitamin D from the skin. So due to the malabsorption state, diarrhea, disease and excessive palates with low calcium and low phosphate content of the food in the children's. So there will be some causes of rickets in the malnourished children's. So they not take proper diet in their routine life. So mothers, relatives should keep a vigilant eye on their proper daily routine diet. So they should be contains all the minerals and vitamins. Yes, this child is suffering from the rickets. Yes, you see, due to the vitamin D deficiency. It's very important, especially for the children's, growing children's. So rickets clinical features, there may be higher increased size of children's, delayed source, frontal pupils. There may be delayed ventilation in the children's due to the vitamin D deficiency. So you should remember through mind, please. So there's delayed dentition in the children's. They may suffer from the vitamin D deficiency. So there is research scores pigeon chest like who suffering from vitamin D deficiency. There may be sclerosis, kyphosis, the children's suffering from the vitamin D deficiency. Limbs, there may be widening of the wrists, ankles, and the other epiphyses. So these are the some cricket clinical features. Please remember mind. Yes, this child is suffering from the rickets. So there's maybe vitamin D. We teach you in the children ward or medicine. So there may be 10,000, 50,000 per day. A child suffering from the vitamin D deficiency. So there may be a rickets heals promptly with 4,000 injections orally vitamin D per day in 1 month. विटामिन डी के इंजेक्शन आते हैं जो ओरली हम उसको पिलाते हैं बच्चों को पानी में या दूध के साथ मिला के. So there may be bony abnormalities on the X-rays. Generally, they disappear over a period of 3 to 9 months. Yes, this child suffering from the rickets. You take the legs. Other very important, vitamin E. These are the, I told you, fat soluble vitamins. It's very important vitamins. So vitamin E, other name is tocopherol. These are the very important in aging. These are the antioxidant vitamins, vitamin A, E, and C. So they reduce our aging process. They play a vital role in antioxidants to maintain our healthy skin, our metabolism. So what are the main functions of the vitamin E? So vitamin E is needed for the normal stability of the red blood cells, told you. So in animals, it has been shown to be for the normal reproduction and for the integrity of the muscles and for nerves. So there is no sound scientific basis to promote fertility and sexual performance. Yes, some doctors prescribe the ladies and the males for the fertility purposes. So they may play a role in the fertility and sexual performance to some extent. Vitamin E. So these are the some foods which are rich source of the vitamin E, found in the corns, maize corns, nuts, olives, green leafy vegetables, vegetable oils, and wheat grains. So these are the sources of vitamin E. So these are the sources I have told you. So another source: soybean oil, sunflower oils, fish liver oils, eggs, walnuts. So these are the other sources of vitamin E. So what will be the daily recommended dose of vitamin E? So 10 milligram tocopherol for men and 8 milligram for women. So this should be considered recommended daily allowance in their routine diet. So vitamin E deficiency disorders. So this may be changes occurring in the severe deficiency, include increased hemolysis of red blood cells, keratinuria, deposition of the brownish white pigments in smooth muscles. In some cases, they develop from the muscular dystrophy due to the vitamin E deficiency. So measurement will be in the final year, medicine or in the peds. So this may be daily dose of vitamin E is 400 to 800 micrograms. Yes, other vitamin, which is the fat soluble, which is known as vitamin K. So vitamin K is concerned with the senses of coagulation factors. You already discussed, you already studied in your previous classes, physiology as well as in the biochemistry. So these play in the coagulation system factors, factor 2, 7, 9, and 10 in the liver. So this is very important in the coagulation system, clotting system of the body. So this mostly occurs in the green leafy vegetables, soybeans, and fish. So they are the natural sources. So enough of these vitamin is produced by the intestinal flora. So these are the some sources of vitamin K. So vitamin K includes the cabbages, and cauliflowers, spinach, other green leafy vegetables, as well as some cereals. So these are the rich source of vitamin K. Functions, you are well aware. So this the vitamin K is essential for the hepatic synthesis of erythropoietin and certain other factors which involve in the blood clotting system. Some solvents also sometimes called the anti-hemorrhage. They also appear to have a role in some metabolism. So sources I have told you. Yes, deficiency disorders of vitamin K. So there may be some hemorrhagic disease of the newborns. So the newborn infants are deficient in vitamin K because of minimal store of vitamin K at birth. So infants, newborns mostly, they may have low level of vitamin K. So lack of stabilized intestinal flora for endogenous synthesis and limited dietary intake since breast milk is a poor source of vitamin K. So it is very important why the children's newborns they suffer from deficient vitamin K. This is the main reason. So there may be biliary obstruction. Bile is prevented from the entering the bowel due to biliary obstruction. So the fat soluble vitamin cannot be absorbed. So this deficiency vitamin K also cause effective blood coagulation. So recommended daily dose is 1 to 2 milligram of vitamin K per kg body weight. Will be safe and adequate intake of vitamin K in our routine daily life, daily diet. So next time we will discuss, inshallah, the vitamin B complex and vitamin C. So these are the very important. So vitamin A, E, C, these are the antioxidant vitamins. They are very vital, especially for the aging persons. They may slow the aging process. Their proper intake will reduce aging process. So our life will be long to some extent. So very important to note these things. If there is any question, please you can ask. So next time we will discuss vitamin B complex and vitamin C disorders. Yes, please. There is any question in difficulty, you can understand properly. You can ask without any hesitation. I think this is the really so simple. We already studied in the year period classes. It's your second year physiology and biochemistry. So just know what deficiency, what the pathological disorders occur due to the nutrition when you do these vitamin D deficiency disorders. Any question, please? You can ask. So today बहुत कम स्टूडेंट आए हैं, प्लीज क्यों? Low percentage of students today is participated. So it may be the bad weather due to rain or light problems. So inshallah next time we will discuss vitamin B complex, vitamin C deficiency or disorders. Okay, please. I think there is no any question. Okay.